Welcome back, dear listeners, to another enlightening episode of Understanding Insulin, the Key to Wellness. I'm your host, Dr. Padma Ramurthy, and we are about to unravel the fascinating journey of how insulin does its job. In our previous episode, we explored how insulin, that incredible hormone produced in response to a carb rich meal, acts as a key to unlock the doors of our body's cells. It plays a pivotal role in guiding glucose into essential organs such as the liver, muscle, and adipose tissue. But how do cells recognize insulin? Picture this: cells have these intricate insulin receptors on their outer membranes, akin to locks. Now, insulin acts as a key to this lock, fitting perfectly into these receptors, thus unlocking a cascade of signaling processes inside the cell. So, these intricate cellular maneuvers lead to opening of the channels, allowing glucose, which is outside in the blood, to enter the cell. But once inside the cells, glucose undergoes glycolysis, a process that releases energy in the form of ATP. It's like the cell's powerhouse, converting glucose into energy. However, there's a twist in the tale. Sometimes these cell receptors, or the insulin receptors, the receptors which are present in the cell membrane, the outer membrane of the cell, or the signaling mechanisms which happens after after the insulin sits on its receptors, can become faulty, leading to a phenomenon known as insulin resistance. Think of it as a malfunctioning lock, making it tough for insulin to do its job. When glucose can't enter the cell, it results in lack of energy, and individuals often feel persistently tired. So, how does this insulin resistance develop? Several factors and conditions can cause varying degrees of insulin resistance. The link between insulin resistance and obesity is a compelling one. Excess fat, especially around your belly and vital organs, is believed to be the primary cause of insulin resistance. A waist measurement of 40 inches or more for men and 35 inches or more for women is linked to insulin resistance. This visceral fat, or the belly fat, produces hormones and substances that contribute to chronic inflammation in the body, and this could worsen the insulin resistance. Physical activity, on the other hand, can make your body more sensitive, can make the cell more sensitive to insulin, and of course, it also builds more muscle, and muscle efficiently absorbs blood glucose. Conversely, a sedentary lifestyle and a lack of physical activity can lead to insulin resistance. Diet plays a major role. Highly processed, high carb foods and saturated fats can lead to insulin resistance by causing rapid spikes in blood sugar levels, straining the pancreas to produce more and more insulin. Due to insulin resistance, the pancreas makes more insulin in order to overcome the resistance and push the glucose into the cell, leading to higher levels of insulin in the blood. This relentless insulin production can lead to weight gain, as insulin function includes converting glucose into stored fat, the excess glucose. Hyperinsulinemia, or excess insulin, is associated with various conditions, including elevated triglyceride levels, atherosclerosis, hypertension, to name a few. So, the complex relationship between insulin resistance, hyperinsulinemia or increased insulin, and diabetes is a pivotal one. Hyperinsulinemia, marked by increased insulin levels, often precedes the development of type 2 diabetes. A fascinating paradox about type 2 diabetes, a condition that affects millions of people worldwide. You've probably heard that individuals with type 2 diabetes need insulin. But here's the twist: Insulin isn't scarce in the early stages of this condition. In fact, even before a person receives that life altering diagnosis of diabetes, when their blood sugar levels are still within the normal range, their body is working tirelessly to produce more insulin in order to keep that blood sugar level in the normal range. It's a silent struggle that often goes unnoticed with no symptoms. Over the years, the pancreas, that diligent organ responsible for insulin production, becomes overburdened. It relentlessly churns out increasing quantities of insulin, all in a bid to maintain and normalize that blood sugar level and fend off that lurking insulin resistance. But there's a tipping point on this journey, a moment when the pancreas, weary from this unrelenting demand, can no longer produce enough insulin to overcome that insulin resistance. That's when type 2 diabetes emerges from the shadows and into the forefront of your health. So now you see the progression of this condition, a path that often begins with excess insulin and ends with the need for external insulin support. In our next episode, we'll delve deeper into the steps you can take to prevent the progression of insulin resistance and maintain your well being. So stay tuned, because the key to wellness is understanding insulin. That's your gateway to a healthier life.